Hi, my name is Jake O'Connor, and the WakeMed Pediatric Weight Management is the program I chose for the pediatric, for the childhood obesity. Um, so, who are they? So the pediatric weight management is a branch in the WakeMed hospital system. There are four total locations. Two of them in Raleigh, one in Apex, and the other in Clayton. What they do is they focus on improving the health and well-being of children and youth facing challenges related to obesity, and they'll service people from birth until 18 years old with a BMI in the 95th percentile or higher. The services include a medical assessment, um, a meeting with a nutritionist, a physical activity plan, meetings with a behavior specialist. Um, they could have a the child could have a bariatric surgery, and then there is also a lipid management as well. So for the medical assessment, the patient will meet with a pediatrician or a nurse practitioner who will evaluate the genetic, biological, medical, and behavioral causes of weight gain and then address it. They'll also diagnose and treat the health conditions associated with weight gain. Health conditions such as pre-diabetes, abnormal cholesterol, a fatty liver, and bone issues. They'll devise an overall plan or an overall treatment plan that'll include lifestyle changes, and um, they'll get support from the dietitians and the behavior specialists. And weight loss medications and or bariatric surgery may be offered. It'll just depend on if the adolescent is um, like fits the requirements of that. Nutrition. A dietitian examines the lifestyle, eating habits, and medical issues to help make a healthy lifestyle change. They'll help families with realistic meal planning, support self-monitoring techniques, and offer meal replacement programs for older teenagers. They'll also, WakeMed also offers free weekly cooking classes that is at various times throughout the year. I couldn't find like the specific times, but I'm sure that they have classes that fit, the patient's schedule. Physical activity. Um, this, um, so they'll meet with somebody who will help develop an activity or exercise plan tailored to the child and the family. And they could be put in to the 4-week personal training program, which is in a gym setting, and that's kind of more for the teens. And or they can do a award-winning 12-week group fitness and nutrition program called Energize. Now, Energize is under the direction of Dr. Samara Hill, They need to be at least in the 95th percentile to be referred to the Energize program. They'll meet over the course of 12 weeks at, and they'll meet 2 times a week in the evenings. Now, I don't know if evening is like 7 o'clock, 8 o'clock. I don't know. Their website, like I couldn't find anything that showed a specific time. Um, the kids will gain tools to confidently adapt healthy habits, and the patients will either enroll in a kids group, which is 6 to 12 years old, or the teens group, which is from 12 to 18 years old. The families of the child are encouraged to participate in all the activities to kind of also like help gain the confidence of doing the physical activities. And it is offered year round, and you can re-enroll at the same location or at a different location. It is taught collaboratively and designed for 6 to 18 year olds, um, and offers a community-based, family-centered approach. Um, Energize continued the average, like according to one of their studies, the average BMI stayed the same or decreased over the course of 12 months. Fasting blood glucose, total cholesterol, low density lipoprotein, triglyceride levels, and blood pressure improved. Muscular strength and endurance increased. Uh, um, the muscular strength and endurance and the flexibility all increased in the participants. And both the kids and the caretakers increased physical activity over the course of 1 year following the program. And families decreased having the sweetened beverages and high fat snacks, which saved them in calories and in money. I could not find anything about the 4 week program. So, the behavior management, they'll meet with behavior specialists who will address obstacles leading to bad habits. So it's like kind of like how the kid eats, when they eat, and why they eat what they eat. They'll address poor sleeping habits, stress, and self-esteem, and will help the families discover strategies for managing and maintaining the healthy lifestyle. The bariatric surgery is a surgical weight loss program for the adolescents with a BMI of 35 kg/M2 or above. Patients need to be seen for at least 6 to 12 months based on their specific insurance requirements. And patients may enter the program at 17 with the plans of having these surgical interventions taking place at 18 or beyond. Visiting the initial visit, they'll go through the medical evaluation, and then um, they'll go over like the lab work and then address the health conditions, uh, discuss the treatment options and formulate the plan. And then after that, there will be monthly visits until they turn 18 to review the progress and challenges, as well as set healthy goals. And this is my works cited. This is where I got all my information from, and this has been my presentation.